Welcome to today's Healthy Bite,
your quick snack of must-know health information.
Hello mothers and family, my name is Gillian Joyce and I'm a midwife. Today I want us to talk about something very important about childbirth, and that is postpartum hemorrhage, also known as excessive bleeding after childbirth, and it's also termed as the PPH, that is in short term. Normally after a baby is born, a mother will bleed a little, just like a heavy period. But if the bleeding is too much, in that it causes deterioration in the mother's vital conditions, like a drop in the blood pressure, a rise in the pulse rate, and other symptoms that compromises their day-to-day living, it makes us know that this mother has had excessive bleeding. And then also in the labor suit, when during the time you're giving birth, your healthcare provider is able to measure the blood loss. That's the amount of the blood you're losing during that process, and it is more than 300 mils, okay? 300 mils to 500 mils in a normal delivery. That is also termed as postpartum hemorrhage. Or if it is a cesarean section, a delivery, and then you lose about 1,000 mils of blood, that is also termed as a postpartum hemorrhage. Okay, my dear mothers, so what should mothers and their families look out for, or what should you watch for after you've given birth or after you've delivered your baby? What will tell you that you're having postpartum hemorrhage, or what will tell you that you're having excessive bleeding after birth? We have one of it is a soaking of your pads within a very short time. After delivering, you've padded yourself, and then within 30 minutes, you feel your pad is soaked, or you're changing your pad so frequently. That tells you that you're having excessive bleeding after childbirth. And then when that bleeding that comes after childbirth is coming in clots, okay, big clots, maybe you've given birth, you're now resting, and then you decide to go for a short call, and then you see in your pad you're having big clots. And then also we have feelings that a mother will have within herself. You start feeling dizzy, losing energy. You start feeling like your heart is beating very fast. Fast heartbeat. That is also one of the signs that you're having excessive bleeding. Or you start looking very weak. You can't sit on your own without being supported. You start feeling thirsty. And then another thing is you're going to have fast breathing. This also tells us that you're having excessive bleeding after childbirth. However, we have a good news, okay? Postpartum hemorrhage can be prevented and treated, okay? What are we supposed to do to ensure that we prevent or treat and manage excessive bleeding after childbirth? Please, all the mothers, we advise you once again to start your antenatal visits early, so that you can be screened, so that you can be examined. Any risk that can lead you to having excessive bleeding after childbirth can be detected early and managed. Okay, and then also if you're feeling any labor-like pain, you start feeling any contraction, we advise that you come to the health facility and give birth from the health facility, because in the hospital we have a medicine that we give you immediately when the baby is born that helps the womb to contract. But if you deliver from home, you deliver on the way, you'll not be able to get this medicine. We also check fully to make sure that there is no placenta, tissue left in the womb, and also we make sure that you don't have a tear which is leading to bleeding. And in case there is any tear, we ensure that it is repaired, okay? The medical team have the expertise of repairing this, closing it to ensure that the bleeding really stops. And then mothers can help by coming to deliver with a skilled birth attendant, then the midwives, the doctors, we have the gynecologist. Please take your time and come to the health facility. So what to do if you are at home? Those are things we can do at the health facility, but if you are at home, ensure that you eat a good balanced diet, food that has iron-rich nutrients that can help to build up your blood level. Giving life should not take your life. With the right care and quick action, we can save every mother. And share this message with other women, fathers, and families, because together we can prevent death from postpartum hemorrhage, which is excessive bleeding after childbirth. It is a collective responsibility. We have our part to do, and the mothers and the families also have their parts to do. So we need collaboration from everyone to ensure that we prevent this tragic death after childbirth from postpartum hemorrhage. Every mother deserves to be there for their babies, and every life deserves to have a mother. That is our babies. Thank you so much for listening today. Click and subscribe to our YouTube channel. Thank you. See you next time. Bye-bye.